I am Dr. E.V. Suranjan Maben, consultant physician and a professor of medicine at the AJ Institute of Medical Science and Research Center, Mangaluru. We will be discussing on latest update in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular disease or CVD, which affects 45% of the people in the 40 to 69 age group. Raised blood pressure is among the most important risk factor for CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, are 51% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. International Society of Hypertension, that is ISH, has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue, that is resource-poor settings. Optimal care refers to evidence-based standard of care, and whereas essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource settings. The American Heart Association and American College of Cardiology has released a scientific statement in 2021 offering a new guidance for the management of stage 1 hypertension among the patients with low atherosclerotic cardiovascular disease or ASCVD risk. Among low-risk adults, that is no ASCVD or 10 years CVD risk of less than 10%, with the stage 1 hypertension, that is blood pressure of 130 to 139 by 80 to 89 millimeters of mercury, management starts with non-pharmacological therapy. If blood pressure remains uncontrolled at 3 to 6 months, we have to consider starting pharmacologic therapy. Acute respiratory distress syndrome, or ARDS, is a potentially fatal condition involving lung damage, and experts often associate it with severe COVID-19. A recent study, which appears in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to the 110 to less than 130 millimeters of mercury range substantially reduced cardiovascular adverse events in the STEP randomized trial, affirming the SPRINT findings for an older Chinese population. And among some 8,500 patients aged 60 to 80 years in China, the intensive target trimmed 26% of the composite CV risk. Findings from now a second major trial supporting a lower target could unite the guidelines, which even among the US professional societies range from thresholds of 130 to 150 millimeters of mercury. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on office blood pressure measurement, but also on out-of-office measurements such as ambulatory blood pressure monitoring or home blood pressure monitoring or HBPM. 24 hours and nighttime BP measurements were associated with greater risks or mortality and composite of CV outcome. Thus, they may considered as the most relevant measurements for estimating cardiovascular risk. For every 20 by 10 millimeters increment of blood pressure measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve adherence to therapy and blood pressure control. Therefore, the 2018 European guidelines recommend, especially in the context of lower blood pressure targets, to start antihypertensive therapy with an initial dual fixed dose combination of AC inhibitors or angiotensin receptor blockers plus calcium channel blockers or a diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitrosodimethylamine or NDMA, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by the WHO International Agency for Research on Cancer to be carcinogenic in humans. If 1 lakh patients would have received NDMA contaminated valsartan from Zhejiang, Hunan, that manufacturing site where the highest levels of contaminants were found, every day for 6 years in the highest dose, it could result in 22 additional liver cancers over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by a significant increase in the rate of emergency department visits of plus 6%. The HYGEA study represents the latest study that tested nighttime antihypertensive treatment, and in this trial, chronotherapy was associated with a significant reduction in endpoints, including death. The HYGEA chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy exerts a favorable CV risk reduction. The largest study included a total of 19,084 hypertensive patients. During an average follow-up of 6.3 years, 1,752 participants experienced the primary CV outcome. An ambulatory blood pressure measurement was performed for 48 to collect data on how blood pressure differed during sleep. The PR reduction of CV events was significantly improved for nighttime treatment when compared with awakening treatment. Thank you.